In Providence, we're very proud of the care we provide to the residents who live with us. Many people come to us because they're unable to manage at home and to cope, and despite the best efforts of their family and the community, they need more care than can be provided. However, when we ask each other the question, would I want to live here? Is this where I'd want to spend the last days of my life? Sadly, the majority of us would say most likely not.
It was really a group of leaders coming together who recognized that if we continued in the way that we were continuing with residential care, we were not going to meet the needs of our people. We started to come together to say, you know what, united, we need to figure something out. We owe this to the people we serve, we owe this to our future people that we serve. The exciting part is we were able to form a partnership with our quality improvement colleagues who came on board to actually give us a little bit of methodology and process in terms of where we are right now and understanding where we are right now in order for us to dream about the future and then take some steps to make the reality happen.
There's two main parts, I'd say, to the Residential Care for Me project. So the first part's really about understanding the experience of the staff and the family members of residents, and then of course the residents themselves. And using all this information, what we'll do is try to design a residential care home or care homes that everybody wants to live in, that we all would want to live in. And I think that's where the title comes from. It's designing residential care not just for somebody, but for me.
Through this process, our hope is that we actually engage people in a way that they have never been engaged with before, very wide scale across our 5 residential care facilities, and with their help, dream and implement something that is actually going to be effective because it will come from them.
We call this the insight gathering phase, and again it's just a much deeper consideration of the experiences of those that serve in care, that live in care, to really understand and inform what we might do going forward.
So what we wanted to do was really understand again what's meaningful to residents here in their life, and so we gave them tiny little disposable cameras, the kind that you would get at a wedding, and asked them to take photos of things that are meaningful to them. They did that over the course of a couple months. We then got the photos developed and then sat down to have a conversation to really, again, understand what they were thinking when they took those photos, what those things mean to them, and hopefully at the end of it we'll start to see patterns and themes out of all the different residents' photos of things that are truly meaningful for residents and be able to design something for them.
So can you tell me a little bit about this picture, Robert?
This is a painting I made for Dr. Wong.
Ah, so you painted this?
I painted it, yeah.
Can you describe the painting?
It's a flower, and I thought she looked so much like a flower.
Ah.
Then I made her one, I gave it to her, and she was so pleased.
Ah, that's lovely.
For me, she felt this world. She's an angel.
She's an angel.
Yeah.
It's very grassroots. We're really starting with people who live in care facilities and learning about their experience, learning what maybe doesn't work as well, what does work well, and really trying to go outside the box and thinking about ways that we can enhance that experience.
That's a key part of this work, is that experienced or human-centered design is what they call it, and it's about really understanding what it's like to be in the other person's shoes.
Families, for the first time for some of them, came together and heard concerns, heard opportunities, and the resounding feedback was, we like this, we like to be part of some kind of future. It gives family members hope that this is an organization that actually wants to make a difference.
Our next steps are to complete the data collection, and then from that, the Think PHC team, which is the innovation team, will help to generate key themes from it, and from there we'll work with our reference groups to try to figure out what ideas we might want to test. So what are some themes that come out strongly, and what are some proposed things we might want to test? Our hope and our dream is that our residential care would be somewhere we'd be happy to live in and happy to have our family members live in.
My experience here is very nice. For me, it's been rewarding. I get new people. It's a new part of my life.